Let's settle for the details of those stories now. JoyNews investigations have revealed how 8 mobile clinic vans imported by the John Mahama administration have been left to rot at the Korle Bu Teaching Hospital. The mobile clinics were meant to bridge the gap between urban and rural health care. The vans come in 4 configurations designed for general medicine, ophthalmology, dentistry and audiology assessment. My colleague Kwesi Parker-Wilson was at the Korle Bu Teaching Hospital and that's the rest of the story.
Just behind me are some mobile vans. So these mobile vans were brought into the country by the NDC administration specifically to bridge the gap between urban and rural healthcare. But it's been left to rot at the biomedical engineering unit here at Korle Bu. There are 8 in all. And so I'll make an attempt to paint a picture of these vans to you. It is an American Ford, the heavy-duty cargo one. It is white and has the colors of the Ghana flag beautifully designed at both sides of the cargo. And a little above the flag is the country's coat of arms. The mobile vans also have the inscription, Government of Ghana, Ministry of Health, and just beneath it is the caption, National Medical Outreach. The vans christened Onyado, literally meaning brotherly love, come in 4 configurations designed for general medicine, ophthalmology, dentistry, and audiology assessment, which has also been written on the cargo. The vans have a power generator, fully air-conditioned interior with its medical equipment, dust covering both the windscreens and the bonnets of the van. Some of the window frames broken, but have been covered with black polythene bags. The power generator is corrugated with a turbine and control flap consumed by spiderweb. I took a sneak peek into one of the vans and I realized that there are some medical equipment still in the vans. And the question is, why has the NPP administration abandoned these vehicles? We'll be seeking some answers from the authorities who are supposed to ensure that they send the healthcare system to the doorstep of our brothers and sisters at the rural community. For JoyNews, I am Kwesi Parker-Wilson.
Call that some sort of financial loss to the state. Alex Sebefia is former Minister for Health, and the vans were purchased when he was in office. So we've been speaking to him, and he is denying that the inability of the NDC administration to properly source funding for the operations of the vans has contributed to what the current state that the vans are in. He's been speaking as well to my colleague Kwesi Parker-Wilson.
One of the main issues or difficulties with mobile clinics is the running cost, and this can actually be quite high. You need to staff them first of all. You need to have qualified doctors, qualified nurses. You're going into the area with where you're going to give a lot of medication free of charge, so you have to get stocks of malaria tablets, antibiotics, etc. on the van. You're going to have the actual maintenance of the vehicle, fuel costs moving from one place to the other, the maintenance of the vehicle itself. So the running cost of mobile clinics is not low. Fortunately, when we started, we had some assistance from donor partners in terms of how we were going to run the program. We then had to begin to look at the possibility of making sure that we had clear budgetary allocation for the running of the mobile clinics.
I see.
The intention at the time was to be able to cover all 10 regions. We were able to do, I think, 3 of them. We partially did another 2, namely Brahafo and Ashanti, when the meningitis outbreak broke up. So basically, the main stumbling block was running cost. And we did try to make some efforts to try and get definite funding. We had looked at the possibility even of increasing the number, but we were never going to increase the number till we knew what the funding source was going to be. We thought that 4 vans in every region was the way forward. So we were looking at a total of 32 to add to the 8, making 40.
40 in all.
So that then it means that the running cost is less, or the fueling, because if the vans are already in the region, you don't have to move all from Accra always back to Tamale, to Upper East, Upper West, and so on and so forth. They would already have their vans, but it still has a very high maintenance cost if you're dealing with 40 vans.
Clearly, one would say that probably not really enough background checks are not being made. It wasn't really thought through before the vans came, because one would have thought that provisions would have been made since these vans were coming into the country.
Yes, and that's simply, as I said, had to do with the funding cost. Now,
so, I mean, there are no proper provisions.
I wouldn't say that there are no proper provisions. In any particular year, you have your budget and you have what you can do with goods and services, and how you run your operations. But no matter how much you plan for emergencies and put aside for emergencies, if you have a year where a number of emergencies occur which totally exceed your expectations, then you begin to divert funds from other sources to meet those expectations. We had the fire after the floods, if you remember.
Right.
It was a major
disaster.
Exactly. It was a major disaster we had to deal with. Meningitis broke out in a way we didn't expect. We had to spend quite a bit of money from emergency fund, and even going back to Ministry of Finance to help us.
So in essence, you are justifying your government failure
to actually continue, because we had to deal with the emergencies. We had the psychiatric hospital issues, if you remember.
Right.
We had to divert funds and move funds into these areas to deal with, if you remember. And so it wasn't for lack of planning, but in the health area, when you have issues that come back to back, no matter how much emergency funds you've put aside, you tend to find that they are quickly whittled away. And now you have to go into your mainstream budget to actually deal with some of these issues that
So
arise.
would you agree with your critics that, I mean, who say you failed in that aspect? I mean,
no.
By not making sure that you kept your commitment towards the people of this country.
No.
By investing in
Why do you know about Oniado? Why do you know about Oniado? It made a significant impact. We did so well in what we were able to actually achieve. We got to the point where even when we were not able to send out the vans, we were being approached by traditional chiefs, we were being approached by church elders who, when they were having a function, they would ask for Oniado vans to be present so they could screen their people. We told them, look, we don't have the funding to do it, but if you have the running cost to send it there and bring it back, you can have the vans. We made them available that way. So Oniado was a complete success, not even partial. It was a complete success because it actually gave hope to people, and it also dealt with a huge number of cases in the regions that it was able to go to, and should be encouraged. And I think that would be totally incorrect to say that it was a failure or we didn't reach expectation. It actually went beyond our expectations.
Former Health Minister Alex Segmefia putting up that defense there.